I'm a reconstructive urologist, and so that really focuses on the restoring function to injuries or traumas or of the urinary tract and sexual organs. My patients have really sensitive topics: erectile dysfunction, urinary incontinence. These are topics that often are not discussed with anyone, sometimes not even their partners. So they really come to me to have sort of a wide breadth of treatment options and also talking to someone for the first time. And so I have specific interest in offering minimally invasive and robotic options for the surgical reconstruction of a lot of my patients' problems. This is very unique to the Chicago area for surgical reconstruction, as well as the entire Midwest. Loyola is wonderful in that we're such a collegial and multidisciplinary center, having colorectal surgeons that are wonderful and having other urologists that may be hyper-specialized in other specialties. That's really what you want in a medical team, is people who are experts in their subspecialties to then all put their brains together and help the patient for sort of a common good. I want my patients to know that they can trust me. I think that's a very important thing at the first meeting with my patients, is that I want them to feel like they can speak to me about anything and that they can trust me. It's usually a long journey for these medical problems, and so I'm there every step of the way and very available. But really it boils down to trust, and that they feel like I'm there to be their champion and their warrior.